సరే అండి. ఓకే.
Okay. So there are few of the modifiers are very important. Just you can note down. I am just telling. Just you can note down in your book. Like modifier 50, 73. Just you can note down. Modifier 50, 73, 50, 73, 74, 50, 73, 74, 51, 59, and 62. Okay, just you can note down these numbers. 50 modifier, 73 modifier,
Ishwar,
74,
మీ వాయిస్ బ్రేక్
51,
అవుతుంది ఈశ్వర్.
59, and 60.
Can you please repeat again?
50, 73, 50, 73, 74, 51, 59, and 62. These are very, very commonly repeated and very important modifiers. Okay, these are appendix A modifiers. Next, there is another modifiers also. I'll tell while I'm teaching in the class. Okay, let us start with the important modifiers. 50 modifier. Just see where is 50 here. Just I'll told all these modifiers also, but first we'll focus on the important modifiers. By the end of the class, I'll deal this. Just see the 50 modifiers. Is everyone seeing the screen? Can you see the screen, everyone?
Yes, sir.
Yes, sir.
This is the bilateral procedure. Okay, 50 modifier is indicating the bilateral procedure. Okay, bilateral procedure. That means two sides. Yesterday, who is in the class? Those people already know about the 50 modifier because we already discussed about this thing yesterday, right? Like any of the procedure is happen to both the lateralities, right side and left side. If those type, if the procedure happens to the two sides, that is considered as the bilateral procedure. Okay, unless or otherwise identified in the listings, bilateral procedure that are performed at the same session should be identified the modifier 50. Like yesterday, what example I told you? For you people, yesterday I told you one example for this bilateral procedure.
A hand
Fracture of the hand and the
Casting.
Fracture of the hand, like for the to that diagnosis, what physician had done, casting had done for the both the right hand and left hand. So in that scenario, what happening is there is one line here. See carefully, like performed at the same session. That is very important. While we are coding, while we are giving this modifier, పర్ఫామ్ ఒక సేమ్ సెషన్ లో మాత్రమే అది జరిగే ఉండాలి. ఓకేనా? ఇన్ దట్ సేమ్ సెషన్ ఓన్లీ టు లైక్ bilateral procedure will be happen. At that scenario only we just give the 50 modifier. Okay, I will tell you one more example also. Okay, repair, simple repair method is there. Okay, simple repair method is there. That means stitches for the skin anamata. Okay, simple repair for the skin, both on the right side of the head and also left side of the head. Right, that means right side cheek and left side cheek. Left cheeky, right cheeky, two sides. Physician had done the simple repair. Because of any of the accident or any of the thing, patient fall on the ground and injury happens to the right side of the cheek and left side of the cheek, and physician done the simple repair procedure. That means what happened here, left side and right side, patient like physician had done the procedure. So for that scenario also 50 modifier will be used. Did you understand what I am telling?
Yes, sir.
Yes, sir.
And there is one more guideline for this, for the add-on codes. Okay, for the add-on codes we do not use this modifier. See this modifier should not be append to the designated add-on codes. Okay, what is the symbol for the add-on codes? Yesterday we already discussed.
Plus symbol.
Plus.
Symbol.
Yes,
So any of the codes is having a plus symbol, that is considered as the add-on code. For that add-on codes, we do not use the 50 modifier. Okay, so that is also one important thing. Next, coming to the 51 modifier, it is also one of the important modifier most commonly used. Okay, see this 51 modifier, it is known as the multiple processor modifier. Okay, it is the multiple processor modifier used when multiple processors are performed in the same session. Okay, multiple processor had done in the same session. Yesterday also I told you one example. Patient is having the appendicitis and also having the gallbladder stones. At the same session only both gets removed. So appendectomy had done and also removal of stone surgery is also done. Okay, so that means in the same session, how many of the processor had done here?
2.
Two processors had done. So that means multiple processors had done at the same session. So that condition, for that scenario also, 51 modifier is most commonly used modifier. So multiple processors. Okay, so there is one more example I will tell you, like appendectomy for the patient. At that time only hernia repair is also done for the patient. Okay, appendectomy had done for the patient at that condition, at that session, at that same session only, both hernia repair and appendectomy had done. Is this modifier suitable that condition? Hello?
No.
Why no?
Yes, because it is done in the same session.
Yes, same session has done. So that's why 51 modifier is used. Okay, so that is one thing. Coming to the 59 modifier, it is also very important. And 59 most common ga ever use చేస్తారు తెలుసా? 59 is most commonly used by the E&M team, evaluation management team. Like if evaluation management team had done any of the procedure, suppose patient visited to the hospital just for the office visit or anything, like for the evaluation management, at that session, at that time, if any of the procedure had done by the E&M team, what is the duty of the E&M team actually? What is the duty of the E&M team?
Basically, it is evaluation and management of the patient's condition and report proper diagnosis.
Actually, for the evaluation is the main primary duty of the evaluation management team. So, but sometimes in any of the emergency department, okay, if any of the emergency department or any of the thing, so in the sense emergency department is also the part of evaluation management. Just remember this thing. Okay, emergency department is also the part of E&M. If any of the E&M team had done any of the procedures rather than E&M service, I'm mentioning rather than E&M service. That means rather than E&M service, if E&M team performed any of the procedure like incision or excision or separation or any of the thing, even any of the thing. Okay, so for that scenario we just give the 59 modifier. Okay, just see here, there is clearly mentioned here, under certain circumstances it may be necessary, it may be necessary to indicate the procedure or service was distinct. Distinct in the sense, what is meant by distinct? Different. Okay, different procedure or independent from the non-E&M service. The procedure duty is not actually by the E&M, but చేయాల్సి వచ్చింది అనుకోండి, at that condition 59 modifier is used. Did you understand when we are using 59 modifier? Can I tell you one example?
Yes.
Okay, I'll tell you with one. Wait. Okay, let us start with one example first. Okay, like debridement. Oh, sorry, last patient just due to any of the accident on the anything like on the road or any place, just went to the hospital due to accident. So injuries are very severe, but came to the evaluation and management department. At that time, what they will do means taking of X-ray. Okay, taking of X-ray or like doing any of the dressing for wounds. Okay, dressing for wounds or stitches. సో ఇలాంటి ప్రొసీజర్స్ అనేది మోస్ట్ కామన్ గా చూస్తాం ఫర్ యాక్సిడెంట్స్. సో those procedures, if those procedure had done by the evaluation and management team, okay, evaluation and management team, at that scenario we can use the 59 modifier. Okay, at that time we can use the 59 modifier. Actually, who is duty to do the stitches, integumentary? There is a special surgery. Okay, there is that duty is actually by the surgery. But here what, who is doing the procedure? Evaluation.
ENM team.
X-ray duty. What is the duty of who will take the X-ray? Radiology. But here evaluation management team lo ఇది చేయడం జరిగింది. సో ఫర్ దట్ సినారియోస్ we can use the 59 modifier. Okay, that it is indicating separate service. Next modifier is 62. 62 is also very not that much commonly used modifier. If any of the procedure had done by the two surgeons, 62. Just remember, if this 62 means two surgeons. Okay, 62 means two surgeons.
ఈశ్వర్ జస్ట్ సెకండ్. సో ఇప్పుడు చెప్పారు కదా ఎగ్జాంపుల్, సో ఏ కోర్స్ తో యూస్ చేయాలి 59?
59 is like any of the suppose ఏదన్నా ఒక కోడ్ చేస్తాం అనుకోండి. when we are coding any of the thing, like ఏదన్నా ఒక ప్రొసీజర్ ని కోడ్ చేస్తాం, బట్ వీఆర్ కోడింగ్ విత్ సపోజ్ మేము కామన్ గా ఎప్పుడు యూస్ చేస్తామంటే, యాక్చువల్లీ ఐఎమ్ వర్కింగ్ ఇన్ ద ఎమర్జెన్సీ డిపార్ట్మెంట్. while we are getting the files of emergency department only, but if the emergency department physician done any of the other department procedures, like మనకి ఎవాల్యూషన్ మేనేజ్మెంట్ లో కామన్ గా వచ్చే కోడ్స్ అంటే 99 కోడ్స్ అట్లా వస్తూ ఉంటాయి. బట్ మనకి అక్కడ ఏదైతే డిఫరెంట్ ప్రొసీజర్ ఏదైనా జరిగింది అనుకోండి, separate service has done by this team. At that scenario we can give the 59 modifier, that is indicated distinct procedural service.
సో ఇట్ ఈస్ అంటే ఈఎన్ఎం కి ఇవ్వాలనా లేదంటే సర్వీస్ అయింది కదా దానికి ఇవ్వాలనా అని? హలో,
We need to give for the service.
Equivalent to the procedure for the E&M. Okay, not for the E&M. ఏ ప్రొసీజర్ అయితే జరిగిందో టు దట్ ప్రొసీజర్, టు దట్ to that process only we can append this 59 modifier. Okay, next coming to the two surgeons. While I'm just telling, just you can note down simply for your understanding purpose only. So two surgeons, it is already in the modifier description only, it is already there. If the procedure had done by the two surgeons, for that scenario we can use 62 modifier. We can append this 62 modifier when two surgeons work together as primary surgeon, and also that is also in the same session, not the separate session. Remember this thing, not the separate session, in the same session only. During the same session, it is clearly mentioned, see here, during the same surgical session, those services may be reported using separate procedure codes with the so this is another thing, like, okay, see here, during the same surgical session. Okay, during the same surgical session, if that is performed, if that procedure is performed by the any of the persons, like any of the two surgeons, at that scenario we can append this 62 modifier. 62 means just you can remember simply only. Like ఇలాంటి ఎక్కడ జరుగుతూ ఉంటాయంటే wait. ఒక న్యూరో సర్జన్ ఒక ఆర్థోపెడిక్ సర్జన్. Okay, ఒక న్యూరో సర్జన్, there is one neurosurgeon and there is one orthopedic surgeon during the spinal surgery, during the spinal cord surgery. So at that time, in some cases, neurosurgeon is needed, orthopedic surgeon is also needed. Example I am telling just for your understanding. For a spinal surgery, neurosurgeon is needed and also orthopedic surgeon is also needed. So those two physicians are perform the surgery. At that scenario, to that procedure, we can append this 62 modifier. Did you understand?
Please once again repeat, sir.
If any of the procedure is there, if any of the procedure had done with the two surgeons, okay, operation, if one operation had done for the patient, okay, one surgery had done for the patient with the two surgeons had done the if they done that procedure, at that scenario just you can append this 62 modifier. Okay, that may be same department or different department. I'm just told you different departments like orthopedic and neurosurgeon, but in some cases, even some cases, both same department persons also will perform that. Next, and one more important modifier is discontinued outpatient procedure. 73. Wait, where is 73? Okay, 73 and 74 are the anesthesia modifiers. Okay, those are anesthesia modifiers. Just you can note down in your book. 73 and 74. Are you following the class?
Yes, sir.
Yes, Ishwar.
Yes.
Okay, 73 and 74, just you can note down for 73. Discontinued outpatient procedure before anesthesia. 73, discontinued outpatient procedure before anesthesia. Just you can note down for 74, discontinued outpatient procedure after anesthesia. Can I repeat again? Discontinued outpatient procedure after anesthesia. 73 is before anesthesia, 74 is after anesthesia. Okay, let us discuss these two modifiers. Okay, these two modifiers we'll discuss. This 73 modifier is procedure had cancelled before giving the anesthesia. Sometimes fluctuation of the blood pressure or sugar levels or patient stress or mental behavior of the patient, due to the several reasons, procedure had cancelled. At that scenario, we can use the 73 modifier for before anesthesia only. Before giving the anesthesia only, procedure gets cancelled. Okay, next coming to the 74 modifier. So this 74 modifier is opposite of the 73. That means discontinued outpatient procedure after anesthesia. Okay, after anesthesia. I'm telling you the after anesthesia. That means after giving the anesthesia, procedure had cancelled. sometimes after giving the anesthesia, patient blood pressure will rise, or patient is incorporative. So for that scenarios, sometimes procedure gets cancelled. Okay, so that is the 74.
So can you explain with any more? Sorry, any examples?
For what thing? For 73 or 74?
Both the things.
Both the things. Okay. If patient went to the hospital due to any of the cardiac surgery. Suppose take an example as the cardiac surgery, cardiac related surgery, heart related surgery. If patient went to the hospital, when checking of the BP, okay, when checking of the blood pressure is normal, but few of the people face some fear. Due to fear, the blood pressure gets elevated. But for the cardiac surgery, not only for the cardiac surgery, for any of the surgery, that blood pressure will be in the limited. Okay, blood pressure will be at the limit. At that condition only, surgery had done by the patient. In the case of 74 modifier, if patient went to the cardiac related surgery, anesthesia had given already. Okay, anesthesia had given to that person in the operation theater. But due to the several reasons, patient become like incorporative with the physician, like he is shouting at the physician, he is mentally ill due to any of the thing, or sudden sickness. After giving anesthesia, some people become very sick. That may be any of the reason, but the surgery had cancelled after giving the anesthesia. Okay, anesthesia ఇచ్చిన తర్వాత కనుక surgery cancel అయితే, for that condition, for that scenario,
So can you tell in English?
we can yes, I am telling both the languages. Okay, because few of the people, Telugu people, not understanding in English, so I am repeating both the languages. Okay, for that scenario, we just give the 74 modifier. That means discontinued surgery is happened to the patient. After giving the anesthesia, surgery gets discontinued. Okay, for that scenario, we can use 74. Before giving the anesthesia, if surgery gets cancelled, we can append the 73 modifier. Okay, can I move on to the another modifier another modifier? Hello.
Yes, sir.
Yes. Yes.
Okay, sir.
Okay, let us start with the another modifiers also. Today, after completion of the session, I will send you the MCQs related to the all these modifiers. Okay, just you can solve all those things.
Sir, the modifier symbols, modifiers, PDF petless. Okay, I forgot. Praveen, just you can message me in WhatsApp. I'll share you. Okay, I'll share in the group only.
Yesterday's PPT also, sir.
Yes, he's also asking that same thing. I'll send you by today.
యాక్చువల్లీ గ్రూప్ లో మెసేజెస్ చేయడానికి పర్మిషన్ లేదు, అడ్మిన్ ఓన్లీ మెసేజెస్ అని. యాక్చువల్గా అది అట్లా ఉంది మాకు.
అవునా, okay, just you can message me personally, no problem. Okay, if you have any of the thing, just you can ask me personally also. And actually increased procedural service already I discussed yesterday. Unusual anesthesia also. Next, professional component. Just coming to the professional component, it is also most commonly seen thing. Okay, professional component in the sense there is a two components. One is the TC modifier. Okay, just remember TC modifier. TC means technical component. TC means technical component. There is no specific numerical modifier. TC itself is only the modifier. Okay, TC is the modifier. PC is the professional component. The PC professional component modifier is 26. It is opposite to the TC. TC is opposite to the TC. Like it is the professional component, that is the technical component. I'll tell you one example. When you went to the hospital, if any of the equipment is used, okay, if any of the equipment is used, hospital equipment only you are using. For taking X-ray, hospital equipment. For taking anything for like any of the MRI or any of the radiology or any of the thing, that all is the under the hospital only, not outside. Okay, just remember that is not the outside. That is the professional component. See here, I am telling, I will tell you clearly. Certain procedures are a combination of physician or other qualified healthcare professional and technical component. When the physician or other qualified healthcare professional component is reported separately, that service may be identified by the adding modifier 26. For 26, I will tell you one example. Patient had taken MRI. Okay, physician had taken MRI for the patient, for ex-patient. So the MRI is taken by the physician and also like what we call that, reviewed by that MRI scanning report is interpreted. Okay, that had reviewed by the physician only. That MRI is taken by the physician and reviewed also by the physician only. That means reviewing. Interpretation. Okay, interpretation is also by the physician. If both the things is, by the physician, you can give the PC. That means professional component. Interpretation is the professional component. Okay, interpretation is the professional component. అంటే ఒక ఐ విల్ టెల్ యూ బోత్ ఇంగ్లీష్ అండ్ తెలుగు ఆల్సో, జస్ట్ వెయిట్. ఒక పేషెంట్కి ఎంఆర్ఐ స్కాన్ తీసాడు ఫిజిషియన్ హాస్పిటల్కి వెళ్తే. ఆ ఎంఆర్ఐ స్కాన్ ఎవరైతే ఫిజిషియన్ ఎంఆర్ఐ స్కాన్ చేశారో వాడే ఇంటర్ప్రిటేషన్ చేశాడు. ఓకే, ఇంటర్ప్రిటేషన్ అంటే రివ్యూ మొత్తం కూడా ఎలా ఉంది ఏంటి అన్నీ కూడా వాడు టైపికల్గా టైప్ చేయడమో లేకపోతే రాయడమో ఏదో ఒకటి చేసి రిపోర్ట్ ఇస్తాడు. సో దట్ ఈస్ ద ప్రొఫెషనల్ కాంపోనెంట్. ఇఫ్ దట్ ప్రొఫెషనల్ కాంపోనెంట్ had done by the physician అంటే ఇంటర్ప్రిటేషన్ చేశాడు అనుకోండి, 26 అనే మోడిఫైర్ ఇస్తాం మనం. ఓకేనా, 26 మోడిఫైర్. ఇప్పుడు కమింగ్ టు ద like in English I will tell you one example. Patient went to the hospital and physician taken one MRI scanning report. Actually what is our procedure in outside hospitals? What is following? Radiologist had taken MRI and that MRI report had done like reviewed, interpreted by our physician. Evaraithe who ordered that MRI, okay, who ordered that MRI, that physician only interpreted the report. That physician only reviewed that report, but not the radiologist. Okay, that is actual procedure. If the physician taken the both the technical component, like taken the MRI and reviewed the thing, just you can give both TC and 26 also. TC and 26. TC means technical ga ante vaadu technical in the sense he only take the MRI and he only interpreted the reports. That means two things here, both TC and 26. Okay, at that scenario we can give this modifier.
సార్ ఒక అమ్మాయి వెయిట్ చేస్తుందండి, షీ రీజాయిన్డ్.
Okay, this is about the 26.
So is this the value 26 and 3C in both are happened?
What?
For a code we can apply both the TC and 26 modifier?
Actually that is also like when we are using the 26 modifier. Okay, when you are using the 26 modifier, that is That is
Actually, actually, as per my knowledge, as I know that when a physician reads the report and the test was performed by the facility, which was not owned by the physician, then we are using 26 modifiers. And when the facility wants the equipment that does not interpret that the result, then we are using this modifier.
actually one thing is here that when the separately, if it is separately given without interpretation, okay, without interpretation, only technically only mentioned without any interpretation, at that time just you can give TC only. No need to give the 26 because there is no interpretation in that. But in some cases what we are doing means, like if in some client based guidelines, if 26 is given, no need to give the TC. Okay, some of the people are following like that. But in few of the CPT, like CPC bits or CCS bits, just sometimes like given as the TC also along with the 26 in the options. So that's why I told you like that. Even in my department also, we are not using 26 with 26 along with the TC.
Okay, sir.
Actually, when we use 26, no need to use the TC, because in that only 26 only TC is also bundled, because here see this
Uh,
thing, technical component is bundled.
okay.
Okay,
So is that one is options is coming like 26 plus PC.
but
This
1 year
specific.
back, actually while I am writing my CPC examination CCS, at that time I just observed this thing. That's why I told you. But actually, if in any of the interviews, I will tell you one thing also. If any of the interviews, if any of the interviews sometimes asked you if 26 is given along with this TC is given or not, just your answer is no need to give the TC when we are using 26. This is the correct answer.
Okay. Okay.
Okay.
Okay.
So if both the components are performed, then we need to use which modifier? So we need to
26
use.
only. Just you can use 26 only. As per guidelines, you just use 26 only. Okay.
Okay,
Ishwar,
both.
TC
చెప్పండి.
Ishwar, TC
You
modifier అనేది ఓన్లీ క్లయింట్ స్పెసిఫిక్ గైడ్ లైన్ కదా, ఐ మీన్.
అవును, that is only client specific only.
ఓకే, థ్యాంక్ యూ.
Okay, that is basing upon the companies they are following. But as per our CPT guidelines, just if we are using 26, no need to give the TC is one of the guideline, because TC is already bundled in the 26 here, the professional component and the technical component. Okay, so just guys, you can remember this thing only. If I'll tell any of the outside guidelines, just you may confuse, just you can follow. When you are using 26, no need to give the TC, just you can remember like that. That is standard thing. Next, one more important modifiers.
Class recordings will be available, right?
Yes, available only. So coming to the 25, it is also like one of the using modifier only. For emergency department persons, it is very important modifiers. Like separately identifiable evaluation management service by the same physician or other qualified healthcare professional. Significantly separately identifiable E&M service. Okay, significant separately identifiable evaluation management service by the same physician or other qualified healthcare professional on the same day of the procedure or service. That means I will tell you with one example. Just wait. Actually, patient came to the hospital with any of the, it is also like similar to the 59 modifier. Okay, it is also similar to the 59 modifier. Let's see. So 59, where is 59 here? I told you distinct procedural service. So when this 59 modifier is used means in evaluation management and also other services like for debridement had done for the skin, at the same time only laceration repair also done by the physician. So debridement is one of the procedure and laceration repair is one of the separate procedure. That means both are different procedures. Okay, one procedure is different from another procedure. At that scenario we can use 59. Okay, just remember this thing, distinct procedural service in the sense when we are using, when a physician is doing one procedure like debridement, he is example for he is doing debridement procedure. At that session, at that time only, along with the debridement, if he is doing any other procedure like any of the repair or any of other procedure, that is indicating that one procedure is different from another procedure. At that scenario, just you can give 59 modifier. Like for evaluation management services, non-evaluation management services, we can give 59 modifier. But in the case of 25, it is significantly separately identifiable evaluation management service that is not related to the evaluation management. At that scenario, just you can give that 25 modifier. Okay, that is the, just understand the difference between 25 and 59. It is only 25 is only complete for the evaluation management, but in the case of 59, that is for the one procedure is different from the another procedure and చెప్పడానికి మనం 59 అనేది యూస్ చేస్తాం. But here 25 is using when we are using evaluation management. Along with that, when we code any other code, just we can give 25. Okay.
Can you say an example?
For that thing, example in the sense, patient came for evaluation management and had any of the other unrelated to evaluation management, just you can append that modifier. Next, discontinued procedure. Already discontinued procedure in the sense if any of the discontinued procedure had done with any of the reason, just you can give 53 modifier. These are only very important modifiers, most commonly used modifiers. Wait, I'll see if any of the modifiers are there extra.
సో యాక్చువల్లీ ఇంతకుముందు 73 and 74 చెప్పారు కదా డిస్కంటిన్యూడ్ కి. సో 53 ఇట్లా చెప్తున్నారు. సో దీనికి దానికి డిఫరెన్స్
అది ఓన్లీ ఫర్ ద అనస్థీషియా. ఓకే, దట్ ఈస్ సబ్జెక్టెడ్ టు అనస్థీషియా. అనస్థీషియా ఇచ్చాడు, అనస్థీషియా ఇవ్వలేదు అని స్పెసిఫిక్ గా మెన్షన్ చేస్తే at that time just you can give that thing.
సో ఇది అయితే 53
is like, wait, I'll tell you. I told you 53 discontinued outpatient procedure, and they're clearly mentioning that outpatient procedure. Okay, that patient is not the inpatient. అంటే తను వచ్చిన తర్వాత ఆ సర్జరీ ఆ ప్రొసీజర్ చేయించుకుని వెళ్ళిపోతాడు. డిస్కంటిన్యూడ్ అవుట్ పేషెంట్ ప్రొసీజర్ బిఫోర్ అనస్థీషియా. ఓకే, discontinued outpatient procedure before anesthesia, discontinued outpatient procedure after anesthesia. మీకు ఏంటంటే ఇక్కడ just observe one thing, that while I am telling you the modifiers, while I am telling you about the modifiers, just you may confuse about the modifiers. Okay, you may confuse about the Praveen, are you recording the session today?
Yes sir, I'm recording.
Okay, like if any లైక్ అదే అనమాట. 73 74 డిఫరెంట్, ఇది డిఫరెంట్. మీకు ఏంటంటే నేను మాడిఫైర్స్ చెప్పేటప్పుడు అన్ని ఒకలాగానే ఉన్నట్టు అనిపిస్తాయి, బట్ ఏంటంటే కేసెస్ చెప్తాం కదా, కేస్ స్టడీస్ లో మీకు డిఫరెన్స్ అనేది తెలుస్తుంది. నేను ఇవాళ మీకు సెండ్ చేస్తా ఎంసీక్యూస్, రేపు మనం అవి ఎంసీక్యూస్ డిస్కస్ చేద్దాం. ఒకసారి సాల్వ్ చేసామనుకో, విచ్ ఆర్ రిలేటెడ్ ఫర్ అవర్ సిసిఎస్ సిపిసి రిలేటెడ్ లో మాడిఫైయర్స్ ఏ విధంగా వస్తాయి మనం చూద్దాం. నేను మీకు ఇవాళ ఐ విల్ సెండ్ యూ టుడే 20 to 15 to 25 questions I will send you today. Just you can go through that and search for the modifiers, which is suitable modifier that case annadi, just you can go through that. Okay. So there are different modifiers here also, but what are the modifiers still we have discussed? What are those type of modifiers? Appendix. I told you, appendix 1 modifiers. There is a big heading about the modifiers. Appendix A modifiers. Okay, just remember all these set of modifiers are the appendix A modifiers. When any of the interviewer asked that what are appendix A modifiers, don't be confused. What modifiers still we have learned, those modifiers are the appendix A modifiers. So these are about the modifiers. Next I will tell you these things. This is also very important thing. Level 2 modifiers. These are the modifiers very important for the telling clearness of the laterality, to tell the clear laterality. క్లియర్ గా లాటరాలిటీ చెప్పడానికి ఇవి చాలా ఇంపార్టెంట్. దీన్ని హెపిక్స్ మాడిఫైయర్స్ అంటాం మనం. దీస్ ఆర్ కాల్డ్ యాజ్ ద హెపిక్స్ మాడిఫైయర్స్ ఆర్ హెచ్సిపిసిఎస్ లెవెల్ 2 మాడిఫైయర్స్. If any of the procedure had done for the upper eyelid ganaka edana procedure chaste, just we can give the E1 modifier. E1 is also one of the modifier, and like this there are a set of modifiers. Okay, there are set of modifiers. From this also I will send you some questions. Just you can find out the modifier which is related to that specific anatomical site. So here clearly mentioned right hand, left hand. Right hand thumb is there, left hand thumb is there, left hand second digit is there, right hand second digit is there. Like for the digits, hands ki gaani, మన టోస్ కి కానీ ఏమన్నా సర్జరీస్ కానీ ప్రొసెసర్స్ కానీ చేశారు అని స్పెసిఫిక్ గా టు మెన్షన్ డిజిట్స్ క్లియర్లీ, టు మెన్షన్ ద anatomical site clearly, we can use this type of modifiers. These are called the what type of modifiers? These are called level 2 modifiers or HCPCS modifiers. Okay, just see this thing. TA means left foot great toe. Toes, left foot great toe, left foot second digit, left foot third digit, like this. I will tell you one example, just give me the answer. Debridement had done for the debridement had done for the right side foot, third digit, right side foot third digit. What is the modifier? T7 is the right side foot digit. T7 is the correct modifier. So ఆ విధంగా మనం యూస్ చేయాలి. So another thing, simple repair procedure had done for the lower right eyelid, right lower eyelid.
E4
is one. E4 is the answer. Like that these are very important. Okay, to give the clear anatomical site. Okay, so in that way these modifiers are very important. Like that, just you can go through this. And there is XE, XP, XS, XU. These are the HEPIX modifiers. I'll tell you about these things also. Okay, just see the XE modifier. Coming to the XE, these are all the Hepix modifiers only. Okay, these are called the subset modifiers of the 59. 59 subset modifiers అంటారు అన్నమాట ఇట్లా. XE. So if anyone of you asked what are XE, okay, if anyone of ask you what is XE, what is XP, XS, XU, just you can tell like this: XE, XP, XS, XU are the subset modifiers or the 59 modifiers. Okay, these four are the subset modifiers of the 59 modifier. Just I'll tell you XE modifier. It is the separate encounter. Okay, separate encounter. That means service done during encounter on the same day. Service had done during different encounter on the same day. పేషెంట్ వేరే కంప్లైంట్ తో హాస్పిటల్ కి వచ్చాడు అనుకోండి, ఫర్ ఎ డిఫరెంట్ కంప్లైంట్ పేషెంట్ టు ద హాస్పిటల్, బట్ దట్ ఈస్ నాట్ ద ఎన్కౌంటర్. ఓకే, పేషెంట్ సపోజ్ విత్ ఏదో వన్ వెయిట్ ఫర్ వన్. నేహా చెప్పండి.
Does encounter mean session? Separate session could also.
Separate session? No,
Yes.
no, not the separate session. Same day only, same session only. Suppose I will tell you one example. Today patient came to the hospital with a one type of encounter. Okay, suppose for the fever he came to the hospital. Okay, for the fever he came to the hospital, but service done during different encounter on the same day. But ఇక్కడ ఏమైందంటే at that time if physician had done any other procedure which is not related to this encounter, different encounter. Okay, did you understand what I am telling, or can I tell again?
Different symptom or maybe different diagnosis or finding.
Yes,
A work is also done along with that.
yes, at that
Okay.
scenario we can give XE.
XE. Okay.
See, and these are not commonly used on floor coding. On floor medical coding we are not using this. This is also a specific company based only, like few of the companies are following HCPCS. Okay, hospital billing companies are there, few of the hospital hospital coding companies, so they may used maybe. Next, coming to the XP modifier. XP. So XP modifier. So XP modifier is used when a separate practitioner, it is indicating separate practitioner, different provider performed the surgery. Okay, for the అంటే ఇక్కడ ఏంటంటే మనం డిఫరెంట్ ప్రొసీజర్ అన్నాడు కదా, మనం నార్మల్ అపెండిక్స్ ఏ మోడిఫైయర్స్ ఉన్నాయి కదా అనుకోవచ్చు. దట్స్ వాట్ ఐఎమ్ టెల్లింగ్. దీస్ ఆర్ HCPCS modifiers. Okay, these are HCPCS modifiers. Those are different modifiers. These are different modifiers. XS in the XP. XP means separate practitioner, different provider performed service. Okay, different provider performed service. That means how can I told you, if a suppose example only I'm telling you, if any of the pulmonologist is there, if pulmonologist had done any of the procedure which is related to the cardiac. Okay, here what is the duty of the cardiologist? To to go with only cardiac related cases. But in some cases, in some scenarios, if pulmonologist had done any of the procedure which is related to the cardio, for that scenarios we can use the XP. That means separate practitioner. Did you understand? Suppose if any of the anesthesiologist is there, whose duty is to give the anesthesia?
Anesthesia.
Anesthesiologist.
But in some conditions, in some cases, physician only directly if give the anesthesia. That is also one of the example for this. That means separate practitioner, XP. That means which is not related, but he is doing that. XP. Coming to the XS. XS is the separate organ. Okay, separate structure or separate organ, different organ structure. Some of the people is having few people are having 6 fingers. Okay, few people are having 6 fingers. Few people are having how can we tell? So those type of abnormalities are there. That means a separate structure had developed. Okay, separate structure is developed. For that condition also, XS modifier is used. Coming to the XU. XU means it is the unusual non-overlapping service. That means అసలు చేసిన ప్రొసీజర్ కి ఓకే ఫర్ ద ప్రొసీజర్ దట్ ఈస్ నాట్ ఎనఫ్ ఫర్ దట్ ప్రొసీజర్. అంటే ఏదో ఒక ప్రొసీజర్ చేసినప్పుడు అది కనీసం దానికి సంబంధించిన ప్రొసీజర్ కాకుండా వేరే ఏదన్నా ప్రొసీజర్ చేసేసాడు అనుకోండి ఫిజిషియన్. ఫర్ దట్ సినారీ XU ఈజ్ యూజ్డ్. అన్యూజువల్ నాన్ ఓవర్లాపింగ్ సర్వీస్ డస్ నాట్ ఓవర్లాప్ usual components. Service does not overlap usual components. Okay, these are the modifiers. This is about all the modifiers. And the finger related to modifiers XP, XU already we had completed. So I will send you few questions. Just you can solve that, and tomorrow we'll discuss in the class. This is about the modifiers. Okay. Anyone of you have any doubts or anything, you can ask me, or we'll stop the class. If you